Hello Mouses, this is a bit of a trans special one today, so anyone who's not interested in trans issues will probably want to look away because this is going to appall you. I am today talking about the case that's coming up. At the moment it's just an investigation, but it looks like it may actually go to a fitness to practice trial for Dr. Richard Curtis. Dr. Curtis is one of, if not the only, trans treatment people in the UK in a private practice. Most treatment of trans people in the UK comes through a gender identity clinic, which is where a bunch of psychiatrists group together as a specialty and deal with treatment of trans patients. Not all GICs are very good. In fact, several of them I would have cheered and held street parties for if they'd been shut down, and one of them was shut down. I'll talk about that one a bit later. But GICs are usually the way that people get treatment if they have gender identity disorder. Dr. Curtis, however, isn't a psychiatrist. He's a GP, and he's gone into private practice specialising in the treatment of gender identity problems. And that's where the problem with his current case comes up. He's been prescribing hormones and dealing with treatment options and referring for surgery. But in Britain, the only way you can actually do that without getting pulled up for problems is if you're a psychiatrist. I don't understand why this is, because to be honest with you, it's not a mental health issue. But in the past, it was dealt with as a mental health issue. Transsexuality itself is not a mental disorder. It's been taken off the list of mental disorders for pretty much every manual except the DSM, which has stuck to it and clung to it for dear life. And the reasons behind that are purely political. So we'll move on. But because Dr. Curtis is not a psychiatrist, he was told that he wasn't allowed to prescribe and refer for treatment unless he had a second opinion from a psychiatrist. He of course ignored this, and as a result there is now a case being put together under investigation by the General Medical Council, which is the regulatory body for doctors, and it looks like it may go to a fitness to practice hearing. One of the cases they are hearing is of a patient who went to Dr. Curtis, transitioned from female to male, now regrets it and is going back to being female, and has, of course, put in a complaint. Well, these things happen because there are a lot of confused people, and the fact is there isn't a specific treatment method that has a checklist of tick, 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 tick. Here's all of the medical scans that we've done, and this person is definitely trans. The doctor can only go on what they're told, how the patient presents themselves at the meetings, and any evidence that the patient can provide. However, all of this can be faked. We know this because the specific route for getting treatment for the majority of doctors at Charing Cross during the late 80s and early to mid 90s was to fake it. We were all told if you were going with Charing Cross, even when I was trying to get treatment in 1999, we were told if you turn up in jeans, you will not get treatment at Charing Cross. If you tell them X, Y and Z, you will not get treatment at Charing Cross, because you had to present yourself in a certain way. So we all know that the way to get treatment is to fake if you think your doctor's not going to give you treatment. So this is what happens. Because of the bad doctors of the past, the current doctors can't do their job without worrying that a patient is faking. And sometimes a faker will get through. Or sometimes a person who is so confused with themselves that they genuinely, honestly believe that what they're doing is the right thing will get through. Because there's no clear way to identify and treat. And that's just a fact of life. So I really get annoyed when the GMC jumps on the one person who is dealing with treatment properly and effectively and responsibly and treating their patients like a human being instead of a fucking statistic, are the ones that always get attacked by the GMC. It's the bad doctors who go, oh, this person is making us look bad, we will make an example of them. That's what happens. That's what appears to be happening here. And if you think what I've just said is bad, have a look at this list of a few quotes from the thousands that have been on Twitter on the hashtag #TransDocFail. These are just a few representations of what happens to trans people when they try and get treatment. And this is a lot of the time before they've even got to the GIC, where there can be more abuses, more failures by the doctor. And when you see that there's one doctor who doesn't do this, he actually tries to be responsible and reasonable and a nice person, and he gets pulled up by all the bad doctors. I have never seen a case at the GMC against a bad trans doctor. And the reason this is because they terrify their patients. You can't complain. They'll destroy your treatment. They'll make sure that you can't get treatment. Having said that, there is one case of a bad doctor that stands out. And he didn't get a GMC trial, as far as I can find on the internet anyway. He used to run the GIC in Newcastle in the late 90s. And he was known by everyone, especially people in the medical profession who dealt with trans people, as Dr. Death. Now, he doesn't practice anymore. His GIC was shut down. His GIC was shut down a year after I was referred there. I never got to see him because he did one of the standard things that happens with trans people. Your referral gets lost or delayed or put aside because you're on a waiting list. I was on that waiting list for 5 years. The GIC had closed down the year after I was referred there, but no one told my doctors. So for 5 years, I was told that I was on a waiting list and I just had to keep waiting. And I was pushing and pushing and pushing to get some treatment or just some indication of when treatment would happen for 5 years. That's basically the start of my trans story. I was going to transition. I had planned this out. I went to university. I was going to transition when I was at university. And by the end of the university career, I would have my entire real-life test done so that I could go and get surgery. Oh, by the way, the real-life test is where you have to act in the role of that you are transferring to. In my case, it would be 2 female. For 2 years before you will get any HRT on the NHS, which means that for 2 years you are basically going to be having to deal with all of the abuse that will come from that. That's the recognised treatment path for trans people. 2 years of abuse in the street before you can get any kind of treatment. And they wonder why we don't like doctors. So after I found out that the GIC had closed, I was never going to get the referral that I wanted. I went private with Dr. Reed and continued to push for treatment on the NHS. Eventually, when I moved doctor's surgeries, I was referred to Edinburgh. I had to leave the country and go to another country. Yes, I know it's part of the UK, but it's still a different country, in order to get treatment on the NHS, because they wouldn't refer me to anywhere else. To be honest with you, I'm not quite glad, because my other referral option would have been to Charing Cross Hospital down in London, when the bad doctors were still rampant there. So that would not have ended prettily for any of us. But I got referred to Scotland, and the doctor I saw was very good, but I had to restart my real-life test because they didn't have any record of me. The fact that I'd been seeing a doctor down in London myself privately wasn't taken into account, and when I was eventually referred for surgery after the real-life test was completed, I was then told by the primary care trust that, oh, you only have one NHS psychiatrist telling you that you can have this surgery. We'll need another one. I was actually at the hospital at the time. Luckily, we managed to pull down another doctor from London who came in and had an assessment with me in the hospital there to make sure that I was alright for treatment. And he signed it off and I got the surgery that I needed. But I was actually at the hospital when the PCT pulled this fucking trick on me, trying to just stop treatment because it's expensive and they didn't want to pay for it. And again, they wonder why we hate doctors. I hate doctors, but I also hate primary care trusts because of how they treat people. The moment that I got any problems after surgery, I was told that, oh, there wasn't any funding for treating me. It was all cosmetic, it didn't matter. No treatment whatsoever. I fought for over a year to get emergency treatment, and that was not nice. But that's what trans people face every day. It's just relentless grind of abuse from both people in the street and from medical professionals that are supposed to be helping us. To be honest with you, there are very few doctors working with trans people in the UK who should not be struck off for abuse. And that's how it is. That's how our situation is. So to find that the one person who people actually like, who deals with trans people in a professional and respectful manner, is now being investigated because he may have broken a shitty rule that doesn't matter. That's just plain ridiculous. And that's all I've got to say for today. So thank you very much for watching. Remember to click the like button. Share it with your friends so that they can see the routine abuses that go on all day. And remember, of course, to subscribe for future videos. I've been Sir Kirk-Robinson. You've been watching the Knob Mouse channel. I'll see you tomorrow.